Welcome to the Biostat Done For You podcast with Noran Hamza, where she'll help you to make the most of your clinical research and contribute to informed evidence-based decisions.
Hello everyone. Welcome to the Biostat Done For You podcast. Today we are going to be talking about the important distinction between correlation and causation. I know. Okay, and how we can use propensity scores to try to interfere causality in observational studies. You may have heard the saying correlation doesn't imply causation. And this is a crucial concept to understand in the field of biostatistics. Just because two variables are correlated, it doesn't necessarily mean that one caused the other. Let's take a clinical example to illustrate this point. Suppose we observe that people with higher blood pressure tend to have higher risk of a specific heart disease. Does this mean that high blood pressure causes the heart disease? No, not really. It could be that both high blood pressure and heart disease are correlated. And there is a third factor, a hidden one, such as the unhealthy diet or maybe lack of exercise. So, how we can determine causality in situations like this? One way is through the use of experimental design, in which we randomly assign subjects to different treatment groups and compare outcomes. However, this isn't always possible, and in certain cases, even not ethical. In these cases, we can turn to observational studies, in which we observe the relationship, the association between an exposure and an outcome in a naturally occurring population. One method for just estimating causal effects in observational studies is the use of propensity scores. This involves estimating the probability that an individual will be exposed to a certain treatment based on a set of observed characteristics. By matching individuals with similar propensity score, we can create more comparable groups and try to count for the potential confounder that may be driving the observed relationship. However, it is important to note that propensity scores alone can't definitively establish causality. They can only help to reduce the influence of confounders and improve the comparability of groups. There are also other statistical techniques to control these confounders, such as multivariate regressions or instrumental variables. So, next time you see a correlation in your result, remember to think critically about whether it could be potentially a causal relationship or not. And if you are trying to estimate a causal effect in an observational study, consider using methods like propensity scores to try to control for confounders and get more accurate estimates. Thanks for listening to the Biostat Done For You podcast. Tune in next time for more discussion on the exciting world of biology.